Hi, welcome back to Seeing the Need, Finding the Solution with the 2011 Home Makeover Giveaway, as we've done for the 6th annual time. But most and equally important is also the offer for free medical care for individuals and families in the Valley who may not have medical care but need to be seen. It's really that simple. Not new to the show and definitely not new to the Maricopa County area is Mr. Tomas Leon, CEO of People of Color Network. Welcome back, Tomas.
Thank you.
Actually, he's on here more than I am, so he actually should be over here. Tomas, for the viewers who haven't had a chance maybe to view the show yet, a little brief aspect of POCN and what you want to talk about before we introduce your guests.
Absolutely. Well, Phil, as I mentioned before in previous shows, our mission is focused on building and creating and maintaining healthy communities. And we do that through a simple principle of providing culturally and linguistically responsive services for people of color in our community. And so we focus on addressing health disparities that exist. What is a health disparity? A health disparity is a particular type of health difference linked to social, economic, or environmental factors. And racial and ethnic populations lag behind. They still lag behind in many health measures and outcomes. And they're less likely to have the preventive care they need to stay healthy, and they are likely to suffer from serious illnesses such as diabetes, heart disease, and it's important that when they do get sick, they are less likely to have access to quality care. And so one of our guests here today, who's one of our valued partners and founders of People of Color Network, Native American Connections, is creating opportunities of healing and hope for people who are experiencing mental health, behavioral health challenges, and substance abuse issues. And so they're here today to talk about their services and programs, and they've been providing services for decades in our community. They have a long history and deep roots, and we also have an inspiring story of someone who's benefited from those services.
Awesome. One of the important things that I heard you say was preventive, and that's about, and I've heard you say before, is about treating well care more than we treat sick care. And in this day and age, it's in the economy, there are so many people who are without insurance and have needs that may have a mental illness, that may have a behavioral health challenge that could benefit. And that's the whole purpose of this show, is that awareness and the stigma reduction, but also let the community know there are providers, there are people out here and collaborators that are willing to kind of step up and help make a difference and see if we can maybe change some things here and get some people some help that really need it during the holiday seasons. Before I introduce my next guest, we're going to show a little bit about what Native American Connections does and what they can do. Go ahead and take a look at this video. We'll be right back with Miss Dee Dee Yazzie.
Native American Connections has been building healthy communities throughout Arizona for nearly 40 years. Our first-class services are designed to help people by improving the quality of their lives. Whether the challenge is substance abuse, mental health, or housing issues, Native American Connections cares. We are here to help. Everyone needs an affordable, safe place to live. Remember us when you are seeking housing opportunities that support your needs. Visit our website at nativeconnections.org, your partner in building healthy communities.
And welcome back. Dee Dee, welcome. How are you?
Thank you.
Dee Dee, you is the Executive Director, correct, of Native American Connections. So up and above the public service announcement, tell us a little bit about what you do, a little bit more in detail.
Well, as Tomas said, we've been in the community for about 40 years, and we were actually founded to welcome Native American people that were coming into the Phoenix area in the early 1970s, that were coming in looking for jobs, health care, educational opportunities, and came to Phoenix and found themselves, you know, socially isolated, really, and then would find themselves maybe homeless on the streets with, you know, behavioral health issues, predominantly alcohol and drug abuse and mental illness. And so Native American Connections was founded specifically, you know, to intervene in the lives of Native American people. Again, as Tomas said, you know, from a culturally responsive way. And so traditional healing and looking at the whole person, and, you know, all the discussion about integrated healthcare.
Sure.
Well, Native American Connections always looked at, you know, the whole person. That mind, body, spirit model was very familiar to us, you know, 40 years ago when we started. And so we're really there to, as you said, provide behavioral health services to a population that may not have medical insurance. And we provide a full range of outpatient services for substance abuse, residential inpatient care. We provide homeless services to youth. You know, we're really an organization that can take some of the community's most desperate population and actually give them a pathway of hope, you know, to recovery.
One thing I love about that People of Color Network in reference to Native American Connections and all the other providers that go along with People of Color Network is how important it is for the different cultural diversities aspect, whether it's Native American, whether it's African American, no matter what it is, how important it is for somebody to be able to relate during the process of recovery. And with that kind of token a little bit, before we come back to you, I'm going to have you introduce your guests.
Absolutely.
So we can tell them exactly what we mean about being able to relate and a story of healing and hope as well.
Well, it's really my pleasure to introduce Ken Lewis. And he, you know, when we talk about the pathway to hope, Ken is the pathway to hope. He actually experienced that, and now he's a very important part of our organization, giving back to the, you know, to the people that are seeking our help.
So Ken, you actually work for Native American Connections, right?
Yes, yes.
And was it always like that?
No, I came in as a service recipient.
Okay, so let's start off and classify a service recipient. And as much as you're comfortable within sharing, what was it like before POCN? Let's start there. Or
Okay.
before Native American
Before
Connections,
Native American
actually.
Connections, okay. I was probably at my last steps in life. Spiritually broke, mentally broke, emotionally broke. One step physically from just basically being in a grave. Lived on the needle. Anything you could put in that needle, injected, IV user, and you know, there were times where, in the worst of my addiction, being locked in the bathroom, thinking, you know, how's this going to end? You know, it's not going to end. You know, and literally crying because I didn't want to put the needle on my arm, but it, you know, it's what I live for. You know, lost all connections with my children. Physically being there, but emotionally, mentally, I wasn't there. You know, I wasn't a father. And that's always been a goal, I guess, in my recovery, is that I wanted to reestablish those relationships. But I remember those dark days. You know, prior to coming to here today, I was thinking, reflecting. And I came across a picture, you know, of me in my worst day, and it's eye-opening. You know, I don't realize how far I've come. But to go back and to look at those things, you know, it's a miracle. It's a miracle that I'm here. It's a miracle that I do the work that I do. You know, it's a blessing, and I live every day with gratitude. And the mission of NAC, you know, when I first came across it, you know, I came in as a service recipient, did 30 days in outpatient, and thought, you know, hey, I have this licked. By that night, you know, I'm drinking at the bar thinking, well, alcohol's not my problem. By the end of that night, that needle was back in my arm, and it took that to really realize, you know, that there was a connection.
Sure. And one of the cunning, baffling, powerful things
Yes.
of addiction is, for the viewers, is a lot of people have the stance and stigma of, oh, why doesn't this person stop, or why can't they stop, or they can do all this stuff. I don't understand why they do this. And what a lot of viewers don't understand in an addiction standpoint is us as addicts lose the ability to choose. In active addiction, we have lost the inability to choose ourselves. It's got to come from a combination of
Yes.
something greater than ourselves, support, and other elements of also giving back to others what is freely given to us, which is that recovery, those people that care, and that hope, and that loss of hope when you're talking about in the bathroom, in the needle, wondering how this is going to end, at the same time wanting to stop but can't.
Yes.
And that torment that goes along with that too. You mentioned about your children, you mentioned about losing people in your life that you love, and another one of the stigmas is also, you know, a lot of people say, well, don't you care about your kids, or don't you care about this? And the reality is, yes, addicts do. It's just 51% of the vote usually goes to the drug. And it's that 2% that confuses a lot of people. After, moment of clarity is also always a point in recovery. Moment of clarity and your start with NAC, which is Native American Connections.
My moment of clarity was not by my choice. You know, they say sometimes that God creator, grandfather, will take you from that dark world, you know, in whatever means. For me, it was incarceration, being placed at NAC, walking into a two-story house that I'm thinking, this isn't a rehab center. This has nothing for me. You know, they said they were going to get me help. They were going to get me treatment. Meeting the staff, you know, having one of the ladies come out and give me a hug and tell me everything's okay. And it upset me because nobody ever told me that. You know, it was 2 days before Easter. I hadn't seen my kids in months. And currently I'm the father of 11 children. You know, at that time it was 7, but for the director of the house to actually tell me, you know, I asked for a phone call, and she says, no, let's do one better. Let's have your kids come visit you, you know. And then for me, asking, well, what's that about? What does she want? You know, what game is this? But seeing my children, you know, was that defining moment. I still have pictures of that day, you know, that I still go back to the men's rehab, you know, and I share once a month, you know, my experience, strength, and hope to show them that, hey, it does work. I've sat in your chair, you know, but this is what I've had to do. You know, your road's going to be different, but to offer that support. So for me, it was being mandated to be there, but meeting great staff that went out on an edge and really dealt with me. So. And
now you're able to give back as an employee. How long have you been with NAC as an employee?
As an employee, it's coming on 5 years in February.
5 years. So. You have 11 children.
Yes.
That can't be easy in this economy to begin with.
Oh, no. No.
So real shortly, we've got only a few minutes left. I'm going to kind of wrap this up and throw a couple things involved. Is one thing that you don't know is up and above all this, I'm involved in quite a number of things. I've been graced to. So after the show, we're going to supply Christmas gifts for all your kids. Mm-hmm. So just go ahead and talk with me after the show. If you have one message very shortly, as you could possibly do, if you could look at the camera over there, for somebody who did exactly what you did, or is doing exactly what you did, is in the same place as you were, but hasn't had the chance nor has made the decision to turn, what is one thing you want to tell them?
That it is possible. You know, the hardest thing is to reach out and to admit that you have a problem and to make that phone call. You know, you go to the meetings and they tell you, you know, call me, and that is the hardest thing is to call. You know, I have 2 sponsees that call me on a constant basis, you know, and we may not have all the answers, but we'll be there, you know, so just call and believe, you know, that there is a way out.
Thank you so much for your transparency. Before we close the show, Native American Connections information is up on the screen as well, POCN.com. There's also a Magellan Services at MagellanofAZ.com. There's also a community exchange program. There's items up there that you can receive that people have donated. There's an opportunity for you to give. Go ahead, it's not on the show, but go ahead and check MagellanofAZ.com. Look for and community involvement. Dutch Bros, $1 off Fridays. Don't forget this coffee, sponsor of the show, STNAZ.tv. And we'll see you next time with a story of healing and hope. Thank you to Didi Yazzie, and thank you to Tomas Leon, and especially to you, Ken. We'll see you next Sunday.